Can a blood test tell doctor that a cancer has come back even before a CT scan shows it? That's exactly why CEA is one of the most important tumor markers in oncology. CEA, it stands for carcinoembryogenic antigen. It is a type of glycoprotein which simply means a protein with sugar molecules attached to it. So during fetal development, especially when the baby's digestive system is growing, large amount of CEA are produced. It is mainly found in the fetal gut, liver, pancreas. So CEA is another example of an oncofetal marker. Now, what happens after birth? Once a baby is born, these organs mature and no longer need high amount of CA. As a result, CA production drop dramatically. In healthy adults, CA levels are usually very low. Think of CA like a training wheels on a bicycle. A child needs them when while learning, but once the child grows and learns to ride properly, the training wheels are removed. Similarly, CA is a useful during fetal development, but is mostly switch off after birth. Now comes the oncology concept. When certain cells become cancerous, especially cells lining the gastrointestinal tract, they start behaving like immature fetal cells again. So, in medical language, cancer cells reactivate genes that were active during fetal life. One of those genes produce CEA. As a result, cancer cells begin releasing large amount of CEA into the bloodstream. The most strongly associated with CA is colorectal cancer. This is where CA is most used most commonly. However, CA may also be elevated in pancreatic cancer, gastric cancer, lung cancer, breast cancer, and ovarian cancer. CA is not specific for one cancer. Many cancers can cause elevated levels. Now, the another important clinical use of CA is imagine a patient with colon cancer undergoes surgery. Before surgery, the CA level is high. Now, after the tumor is removed successfully, the CA level should be back to normal. This is a good sign. Now, one scenario is high before surgery, normal after surgery. So, it means the response to treatment is good. Next, high before surgery but still high after surgery. It means doctor may suspect residual disease. Some cancer cell may still be present. Third scenario, normal after treatment but again started rising again. So this may suggest cancer reoccurrence. Sometimes CA rises 3 to 6 months before scan show recurrence. So that's why oncologists monitor CA regularly during follow-up. And elevated CA does not automatically mean cancer. It can also increase in smoking, liver disease, pancreatitis, or inflammatory bowel disease. CA colon cancer marker for follow-up. Although it can rise in many cancer, it is most commonly used to monitor colorectal cancer.